My name is Sam Pedlow, former FIVB professional beach volleyball player who's represented Canada at over 100 international tournaments and current registered physiotherapist practicing here in Toronto, Ontario, Canada. In collaboration with Bauerfeind, we'll be dropping monthly vlogs and academic blogs looking at injuries that you may experience as an athlete, weekend warrior, or everyday person looking to stay active, exercise strategies that you may use to deal with the signs and symptoms of those conditions, as well as bracing strategies that you may utilize in order to get back to your activity quicker. Stay tuned this month as we dive into knee osteoarthritis. Part 1 of our vlog series here is going to explain the condition, who may be affected, and what we can possibly do about it. The second part of the series is going to look at bracing strategies and a few exercises that you may implement in order to help treat the signs and symptoms of knee osteoarthritis in order to get you back to doing what you love quicker. So, let's break down what osteoarthritis is. Osteoarthritis is the most common form of arthritis, with the knee being the most commonly affected joint. Now, although there's a ton of fear associated with the word arthritis, it's nothing to be feared. I have patients coming into the clinic every single day being told that they have arthritis. They have a fear of being sedentary and unable to perform their activities that they love because of arthritis. Those who are diagnosed with arthritis, though, are not destined to a sedentary lifestyle due to pain or loss of function. It's actually really the opposite. With a variety of treatment options and proactive approaches, those who suffer from arthritis have the opportunity to continue to reduce pain, increase strength, and participate in those activities that they love. So, what is knee osteoarthritis? Knee osteoarthritis is a degenerative condition typically characterized by the progressive loss of articular cartilage, the cartilage that is in between two bones, in this case, the femur and the tibia. It primarily affects individuals later in life and can result in pain, have a negative effect on an individual's activity levels, and result in secondary health complications. Now, all of these are preventable with active treatment or manageable with active treatment. So like we said, you are not destined to a sedentary lifestyle with a diagnosis of osteoarthritis. Knee osteoarthritis is typically classified as primary or secondary. Primary knee OA is characterized by articular degeneration without any underlying reason, okay? Secondary knee OA is a consequence of abnormal force or loading through the joint. Symptoms that typically classify as knee OA related symptoms are knee pain that is gradual in onset, stiffness or swelling in the knee, pain after prolonged sitting or resting, as well as pain that worsens over time with activity. Now, in relation to knee OA, there's both modifiable and non-modifiable risk factors, which are going to predispose somebody to knee OA. Modifiable risk factors include things such as occupation, muscle weakness, imbalance, and weight. Non-modifiable risk factors are going to include things like gender, age, and genetics. So, you've been diagnosed with knee osteoarthritis. What can you do for the treatment and management of the symptoms associated with osteoarthritis? Now, treatment for knee OA can typically be broken down into two subcategories. We have surgical and non-surgical. The primary course of action when it comes to dealing with knee OA is non-surgical management, with surgical management only being considered if non-surgical management fails. Non-surgical treatment options are typically going to include patient education regarding the condition, activity modification, targeted strengthening, knee bracing, or NSAIDs or injections. Surgical management is typically going to involve an invasive procedure that's going to go inside the knee and manipulate the articular cartilage within the joint itself. Recovery period can be quite lengthy, and of course, there are risks associated with any type of invasive procedure. So, today, let's look at two strategies for those who are looking to manage their symptoms associated with knee osteoarthritis. Those two today are going to be exercise as well as bracing strategies. Now, therapeutic exercise has long been proposed as a low barrier to entry, non-invasive therapeutic intervention, which can have a positive effect on pain and function for those suffering from knee OA. Now, these exercises can cover a wide variety of movement patterns or muscles which are targeted, but the aim is to improve muscular strength, neuromuscular control, joint range of motion, as well as aerobic and anaerobic fitness. When it comes to knee OA, the main exercise intervention is to improve muscle strength, however, as muscle weakness is commonly seen in those who are suffering from knee OA. If you pay attention, our next series is going to involve exercises that you may specifically implement at home in order to hopefully improve your quadriceps strength and hip strength in order to help manage those symptoms associated with knee OA. A recent systematic review in regards to the treatment or management of osteoarthritis of the knee suggests that therapeutic exercise is going to provide a benefit in terms of reduced knee pain, improved quality of life, and improved physical function. Now, soft braces also represent a viable treatment strategy in treating those suffering from knee osteoarthritis. Soft braces are typically elastic, non-adhesive orthosis used in the treatment with the primary goal of reducing pain and improving function. Because of their ease of use, low cost, and lack of complications, soft braces represent a viable option in the treatment of knee osteoarthritis, as well as a low barrier strategy for those looking to improve function. A study examining 44 patients with knee OA and self-reported knee instability reported a soft brace reduced activity limitations, improved pain, and improved self-reported stability in those suffering from knee OA. Again, the primary goal, improve function, reduce pain. We can do that with both exercise as well as the use of a soft orthosis. Now, hopefully with a better understanding of knee osteoarthritis, we're able to break the doom cycle and allow patients to understand that they're not destined for a sedentary lifestyle or even have to give up those activities they love. With treatment options such as exercise, bracing, and other non-surgical options, patients can live a healthy, active lifestyle that they have always dreamed of. My name is Sam Pedlow, former FIVB professional beach volleyball player and current physiotherapist, and I want you to tune in next month as we outline braces you may use if you suffer from knee osteoarthritis, as well as a few simple exercises that you can incorporate in order to improve your lower body strength to hopefully deal with the signs and symptoms associated with knee OA.